Yields back. The chair next recognizes the gentleman from Tennessee, Mr. Cohen.
Thank you, Mr. Chair. First, I'd like to quote Judge Moody from Arkansas, a federal judge. He said the diagnosis of gender dysphoria is made by a clinician who assesses whether a patient meets criteria based on a clinical interview, the clinician's observations of the patient, and the reports of the minor's parents. This is how diagnosis of other mental health conditions are generally made. Gender dysphoria is a serious condition that, if left untreated, can result in other psychological conditions, including depression, anxiety, self-harm, suicidal behavior, and impairment in functioning. So these things need to be discussed and determined in a scientific manner and a logical manner, not emotion, not behavior and attitudes that appeal only to voters and to try to gain votes at the ballot box. This should be done responsibly. Transgender people have been around for a long time, and they have rights, and they need to be respected. I read Ms. Scanlon's testimony. I wasn't here to hear it, and I think Penn didn't deal with your situation like they could have and should have in putting up some type of different barriers in the women's area of the locker room, but that's another issue. But things should be dealt with in a different way. This is an easy way for people to try to get points. Pick on a minority group that is the most minority and least understood in our country. And it's gone on for centuries. 100 years ago, it was African Americans. Later, it was Hispanics. Then it was gay people. Now it's transgendered people. Find a group that is not understood and is easy to use to gain political power. It's bad for politics. It's bad for people. Should use science. Parents have rights in raising their children. Athletes have rights. There's a connection. We need to figure out the right answer. And to get the right answer, we need to ask the Medical Association and the Psychiatric Association to choose the people that come before us to testify and give us their opinions on the right way to deal with this issue. Not each group picking people that are favorable to them to put out divergent issues, but people who are experts based on the AMA and the American Psychiatric Association and maybe another association similar, where they pick the witnesses and send them to us to talk about the issue and to suggest a response that would be both fair to the transgendered parent, the transgender child, and the society at large. The Republicans didn't want vaccines and face masks, and they argued that parental rights were sacrosanct then, and parents had a right to direct health care decisions for children. Well, a lot of people died. Tens and hundreds of thousands of people died because they didn't get vaccinated. In gender-affirming surgery, Republicans think the government should make these sensitive decisions. Not necessarily the case. They also believe Americans only have access to health care if their health care decisions match Republican radical beliefs. Republicans fought against the Affordable Care Act. They fought and refused to expand Medicaid in states, leaving millions without health care coverage. 120,000 in my state, Tennessee, not getting health care coverage when the federal government would fund it. They passed countless abortion bans depriving women of safe reproductive health care. They've spread misinformation and tried to undercut medical experts during the COVID pandemic, particularly in Florida. And now they're trying to limit gender-affirming care for transgender youth. By limiting access to health care, wedging their right-wing ideology into the exam room, and substituting their personal beliefs for the professional judgment of doctors, they are causing needless suffering. In the past two Congresses, I chaired this subcommittee. When the Republicans took control, they changed the name, which used to be the Constitution, Civil Rights, and Civil Liberties Subcommittee. They changed it to Constitution, I imagine, with a small c, and limited government. Civil rights and civil liberties were out the window. I was disappointed, not totally surprised, that civil rights and civil liberties were removed. What I didn't understand is, however, this has anything to do with limited government. This does not have anything to do with limited government. There's nothing limited about asserting the preferences and beliefs of federal legislators into individual health care decisions about young people. It's intrusive and it's dangerous. I yield back the balance of my time.